Free universal health care is so complicated and expensive that only 32 of the 33 wealthiest countries in the world have figured it out. The United States outperforms all Anglosphere countries on 5-year survival rates. All of them. So you say, 32 out of 33. Yeah, we outperform all countries of note on the metrics that matter if you want to survive. Oh, we haven't done this in a while, but this has been a topic that was used quite a bit. Guys, remember Michael Moore? He kind of looks like...
yeah, that guy?
Yeah, he kind of looks like Walter White in transition now. But he was a big thing for a while. Like, he actually shaped a lot of discussions that we had on firearms. And then at one point, even healthcare. There was this film Sicko, for people who don't remember, where he showed us how Cuba had better healthcare than the United States and Canada. And you're seeing these same talking points come back, only you're seeing it supported by an unlikely coalition. So it's time to kind of put this to bed, I guess. For this decade, let's go meme check. Yeah, that's one of I like that stinger.
That's good.
And by the way, memes with zero sources, references, or any information even resembling accuracy, it's a really good way to make some money through clicks and ad revenue.
Those are the best, right?
It's really easy because you just all you need to do is figure out what people like or what they think is a thing, and just say that thing back to them. You're like, yeah, that you said the thing, and that's my thing. You're like, isn't that the thing? So here's more of the thing, and ka-ching, ka-ching, ka-ching. So today's meme check comes from the account MetaMateDaz on X. And here you go. It says, free universal healthcare is so complicated and expensive that only 32 of the 33 wealthiest countries in the world have figured it out. And of course, the implication is that the United States hasn't figured it out.
Oh, we're the...
Yeah, we're the outlier.
We're the one.
Yeah, the ones who have created more modern medical innovations and have the best survival rates of any country on Earth. Yeah, we're the ones we're the outlier.
Stephen, it's not free.
Right. Well, here's the truth. So here's the truth, the meme check. And we'll provide all the references as we do every single show. You can go back and watch some pretty in-depth segments I've done on this, including, by the way, me taking a hidden camera through Canadian healthcare, the hospitals where I was raised. This is in 2009. You can search it. So the truth is nobody has free healthcare. It's just not a thing. These other systems have major problems. Now, if you consider 15% sales tax, 52% income tax, in some countries even more, and you still have to pay for 70% of the drugs that you want, which is what the situation was like in Canada when I was being raised there, then fine. I guess it's free. But if you actually understand how economics work and tax rates, it's not free. And then we look at the actual outcomes. The United States has a broken system, and it's becoming more and more broken as we move toward more bureaucracy, as we move closer toward socialized healthcare or a public option. Let's look, though, at the kind of results our system has created. The United States outperforms all Anglosphere countries on 5-year survival rates. All of them. So you say, 32 out of 33. Yeah, we outperform all countries of note on the metrics that matter if you want to survive some kind of healthcare crisis. So let's look at lung cancer. The United States, our 5-year survival rates are 27% higher than the UK. Let's look at stomach cancer, 20% higher than Canada. Let's look at brain cancer, 5-year survival rates, 43% higher than in Australia. Wow. Now, you can look at the taxes, and this is not even taking into account the leftism that comes with these systems, right? Where you're jailed for speech in many of these countries, where you can be debanked because of the coercive government control that's been granted to these authorities. If you have, let's say, brain cancer, let me ask you this. Would you care that it's free? If you were in Australia, if you go, man, I could just be in another place geographically and have a 43% higher chance of surviving. What do you think would matter to you most? Shouldn't we base our system around that and how to best accommodate and foster that?
Yeah, I would definitely go with the health care for my brain cancer and then just file bankruptcy.
Yeah, there you go.
Use that social safety net. Yeah.
If you have to, but the truth is that's not what happens with most people in the United States. They say that because you saw the movie John Q. People in these other countries, by the way, they don't have the greatest financial outcomes because they have a much lower quality of life. And I know what you'll say, Swedes have a higher quality of life than you. Yeah, until you put them in the United States. Swedes in the United States have a 53% higher quality of life than Swedes in Sweden. Same thing for Danes here in the United States when you take them out of Denmark. Here's also some good news, by the way, because the media is nothing but crap all the time. 70% of cancer patients will reach the 5-year mark in the United States. Used to be about 50 in the 1970s. Now, this is the only place where we have the 5-year mark survival rates compared to other nations. It's not perfect, but it's much better. Let's go to MRIs, because you go cancer. Okay, well, that's, not everyone gets cancer. It's an outlier. Okay, sure. Let's go to something that most of you have experienced. And I've had to go through this. My mom had to go through this, severing a disc. In Canada, to get an MRI, you're looking at 16 weeks. And by the way, that's a low estimate.
Jeez.
UK, 6 to 12 weeks. United States, about 2.
I've had several MRIs, and I've never waited more than a week.
Yeah, I was gonna say I've gotten same week MRI appointments.
Well, I've gotten same day.
Me too.
And here's the thing too: the way we list emergency services in the United States, it's very different from in Canada. In other words, you could have a severed disc, you could have a ruptured disc in your back and not be able to walk. You're still waiting 16 weeks. That's where here you might be in a day.
Yeah.
They don't have the ability to do that in Canada. When my mom needed to get an MRI in Canada, that's the empirical. Go check the references. The anecdotal. It was over a year to get an MRI.
Wow.
There were more MRI machines in the state of Vermont than all of Canada. And you don't think of Vermont as a bastion of medical tourism.
Or a big place.
Right.
Highly populated, no.
Yeah, not to mention basic preventative care. Well, that's not a thing. You can go back and watch that video. You want to get blood work because something maybe runs in your family, you want to get checked. If you don't have a family doctor, it's about a 2 to 3 year wait time in Canada. Let's look at elective surgery. In Australia, 49 days. UK, 62 days. Canada, 30 weeks. United States, 28 days.
30 weeks?
And by the way, elective surgery includes like knee surgery, removing a gallbladder, hernia, serious crippling chronic pain.
Jeez.
So it's not just implants and BBLs.
No, and they have, again, different metrics. Like when people often compare to infant mortality rates, they'll say the United States has, actually we have a much higher standard. We consider some of these infants to be deaths where in other countries they just don't. If you equalize it and use the same standard to measure it, we actually have one of the lowest infant mortality rates ever in the history of the world. Elective surgery, by the way, in Australia, it means even the most basic of things. Crikey!
Oh, that's cute. She's got a little pouch.
Yeah, she identifies as one. Appointments with specialists. And by the way, being in Canada, I remember I needed to go see a dermatologist. Also, skin cancer runs in my family. My father had it. It was over a year. It was over a year. This was in Greenfield Park, Quebec. So this is back then. Maybe it's gotten a little better because in Canada, they've opened up to privatized hospitals. That didn't exist when I lived there, right? They always reach the point of no return. They say, okay, well, I'll have some private insurance now. UK, it's about 13 and a half weeks to see a specialist. Canada, it's about 15 and a half weeks. Australia, 26 weeks. United States, 30 days. So you look at
those are high numbers too, by the way.
Yeah. Those are high. We're using the worst numbers that we can find in the United States.
Yeah, we're making ourselves look as bad as we possibly can. I've never waited more than a couple of weeks to see a specialist if I had to.
Right.
Never.
When I snapped my leg, I was there and I had it was drained and I was in for an MRI within the day. Or I had a CAT scan, had the MRI the next day.
So did you guys in Canada? Because we talked about Australia and we talked about their free healthcare and like the brain cancer survival rate. It's like that 43% chance of a better survival rate in the United States. You'd pay anything for that probably at that moment in time, right? But in Australia, they also 50% plus of the population buy additional medical coverage on top. Do they do that in Canada too?
Yeah.
Or you buy your own personal plan somehow?
Yeah. So what happened is there was a famous Supreme Court case in Canada, Quebec specifically, Chouy versus Quebec. You can look this up. I believe it was 2005. I'm going by rote, 2004. There was this doctor, Dr. Chouy, who patients were basically in these long waiting lines. So let's say right now, to see a specialist in Canada is 15 weeks. I would imagine back then it would be over 30 weeks. Honestly, that seems like a very low estimate. It changed because of the Supreme Court case. You had people who were facing certain death. Yeah. But it was, you go in a waiting line. By the way, I've buried relatives. Not me physically. I mean, I'm not. I don't dig graves. But because of basic things that would have been caught in the United States. Cancer, by the time they go in at stage 3 or stage 4, because you're talking about 15 weeks before you get a screening. This has happened I don't think my father would have survived the kind of aggressive melanoma that he had here in the States, in Canada. I don't think he would have been able to get in because we didn't have a dermatologist. Once our dermatologist retired, you're looking at a year to find another one. So in Canada, Supreme Court case, Chouy versus Quebec, people are facing certain death and these obscene waiting queues. And so they went to a doctor and they said, look, I will pay for care. Can you do something for me? And he did that. He received payment to administer care, and people were happy to do it. The government shut it down. Yeah. Government said, you cannot do that. That's it. We have a socialized system. It went to the Supreme Court, and they declared it a violation of fundamental human rights to not allow people to pay for care of their own free will. They said you cannot force people to effectively wait for death if they are willing to use their own money to pay for care.
Well, good on the Canadian Supreme Court.
Yeah.
Finally, yeah.
It paved the way for super hospitals in Canada, as we know them here, hospitals, where people were able to pay for care. And turns out it's better. But you know what happens? What do you think happens if you're living in a country where, I don't know the top marginal rates right now in Quebec. When I was there, it was like 52%. That kicked in well below six figures, to be clear. And 15% sales tax. Actually, 7.5%, I believe, GST, and then it was like 7% PST. So they actually add up the tax, and then you're taxed on tax. In sales tax. So you're taxed on the total of the first 7.5%. What do you think happens if 52% of your income is gone and 15% sales tax? And by the way, the cost of living, whatever you're paying here for gas, usually close to double, if not more, in Quebec. Same thing for milk, same thing for everything you would purchase daily where I grew up. What do you think happens as far as privatized? Who do you think can afford that insurance? Only the ultra wealthy, and it creates a two-tiered system. So you end up right back where you started, only with a bigger disparity. So these are the socialized weight numbers. I bet you if you were to separate them, I don't think that all these numbers separate the newer, meaning the last decade and a half, super hospitals or privatized care versus a socialized healthcare. I bet you the numbers will be probably about double because that's what they always were.
Yeah.
So their solution was moving close. Here's another good example for you. Canada, socialized healthcare, right? There was one exception. Maybe not, there wasn't one exception, but there was a notable exception. LASIK, eye surgery, wasn't covered. So the entire eye surgery, eye corrective industry, early on it was LASIK, now they used, I don't know if they still call it LASIK, maybe it's a different laser. It had to be consumer-based. You paid cash. It was immensely cheaper than the United States. People would travel from Boston, from New York, they'd go and get their eyes done at like $700 an eye, whereas at that time it might have been over $2,000 an eye in the United States because you still had it going through insurance in many cases. In Canada, the one area where it was entirely privatized, it was fast, it was good, it was so effective that people would travel to Canada for this one form of healthcare. No other. Why? Entirely private. And so they were at the cutting edge. That's when my dad got LASIK early on.
I had a teacher that did that, got LASIK in Canada.
Really?
Yeah. Yeah.
Nowhere else do people go to Canada for treatment. They're like, I got to get this done fast.
For meds. I know that.
For medication,
They go for meds, or they used to at least. But
yeah. Well, which actually brings us to the other point too, and I'll get to China in just a second. The United States, we subsidize the healthcare of the world. You know how Canada wouldn't be able to do that? They wouldn't be able to pay for awful, terrible healthcare with quadruple the waiting times if they met their NATO requirements, let alone could defend themselves and be their own sovereign nation. Nations in Europe, they haven't met their NATO requirements, or at least pre-Donald Trump. They hadn't met it for decades, but they were giving their citizens free internet, which also was pioneered here in the United States. Let's change one thing. Let's assume that all the health care is equal. It's not. The actual quality of care is worse. You guys have to defend yourselves. Go. How do you think it would help? Or how do you think it would affect the European nations if that $100+ billion that they were demanding for you, if they had to cough it all up? If all other nations combined, instead of not equaling just the United States contributions, if every one of those nations had to contribute as much as the United States, assuming they had been meeting their NATO requirements. It is international military welfare where we protect the rest of the free world, and it still ends up collapsing, and they have to open it up to privatized healthcare. The United States, we are the top spender of healthcare pharmaceutical research and development. It's not even close, but you pay 2 to 3 times as much, like Josh just said, for basic medicine as Europeans. Why? Because 70% of the profits are from the United States market. Why? Because it's subsidized in Europe. And so it's part of the business model. You, the American worker, pay so that someone in Canada can get an American research created, approved drug, and they get it subsidized by their government as they descend into socialist madness. All the references are available, links in the description. You guys need to know this. When people talk about, I want to help America, yes, but we need to look at the international welfare that we provide as well. They suckle at the teat just as much as some inner city person on Snap here getting Fanta and Coca-Cola. You guys need to know that. But now, because of the Chinese propaganda on social media, along with Iranian propaganda, you guys need to know that. Qatar, China, Iran, Russia, Ukraine, Canada, everyone does it on social media. It doesn't mean that it has to be accurate. They spend a lot of money on propaganda and social media, and it seems to be working with China. People now consider the Chinese healthcare model to be the new darling of the internet. Here you go. Here's a collage for you, D14. And people going, oh my gosh, the healthcare is great in China. It's awesome in China. Okay. In reality, it looks like this, which is strikingly similar to what I experienced in Canada growing up.
A man in Henan posted a video on February 6 saying that getting a simple blood test at the first affiliated hospital of Zhengzhou University felt suffocating. The scene was so chaotic that several patrol officers wearing helmets were there to maintain order.
So it's an airport.
It's the DMV with cancer.
Hospital in Beijing. The medical maze where one wrong turn could cost you hours. In
And your
China,
life.
people don't typically see primary care doctors. Whether you need a blood test or need cancer treatment, you go directly to a hospital.
To see a doctor, you have to register first.
Yep.
Then head over
We
to
had
the
that.
right
It was called the
department for your
CLSC.
consultation. After that, you follow the doctor's instructions and go to other departments for any necessary tests. Finally, you get your prescription, pay the bill, and pick up your medication. Major hospitals are packed with this many patients almost every single day.
Jeez.
Yeah.
It's so much better, Steven. So much better.
I imagine why outbreaks are such a thing
I
in
know.
China.
I know. Or at a Toronto airport, for crying out loud. That was the first SARS. Yeah, we would have to do that. You guys can go watch the video. We'll link it in the description. Where it was, I think we were waiting for 6 hours with a broken arm, and they didn't see anybody. I wanted to get basic blood work. I said cholesterol, blood pressure runs in the family. I really would like to get a workup because I've been having issues. They say it's 2 to 3 years to get a family doctor. Go check the graduates from med school. You might be able to get one more quickly.
So insane.
I'd have to miss a day of school or a day of work, go down to the CLSC, the government clinic, take a number, usually try and get there at 5 a.m., wait for 3, 4, 5, sometimes 8 hours. They always played Mr. Bean on a loop. Anyone who used to go to the Charlemagne, you guys know what I'm talking about. And then eventually you might get the blood work back if you were lucky enough to have a doctor. Otherwise you have to go to another clinic. That's how it worked. That's how healthcare worked there. It was terrible. When I first moved to the United States, I mean, again, I was raised from about 3 or 4 years old in Canada till I was about 18. They were like hotels. I said, wait, someone had to explain to me the concept of like a minute clinic
Yeah.
that you guys have. I go, what? So you mean like I have to go into the big hospital? Like, no, there are these clinics where you can just go in and but it's fast. It's like, it's private. You go in and you can see somebody. Well, how long? Like immediately. I'm like, well, can they like they can do a blood draw.
You're like, how many days does it take? Like 30 minutes.
Yeah, it takes like 30 minutes.
To register? No, to see them.
That didn't exist. It wasn't how I pictured healthcare to be. So you have the empirical and the anecdotal here, but I highly recommend that you prep yourself in knowing the empirical because people are trying to sell you this false bill of goods and they know what I've just told you. They're just hoping that you don't look into it. Hey, thanks for watching. If you liked what you saw, you can click around and watch one of these videos on YouTube or head on over to Rumble and subscribe where I am live every weekday at 11 a.m. Eastern. Live on Rumble. YouTube is dead. Rumble did it. And on Rumble, you can say